From my perspective, it's really looking at training and doing more effective training. One of the things that we do in Parallax Online is to look at how we can reduce or eliminate the investigator meeting costs. One of the things that sponsors will do is spend hundreds of thousands of dollars on an investigator meeting. But what is the ROI? And I think that's a big question. What is the return on investment on that investigator meeting? If you bring a lot of people together, you give them PowerPoints, you have people sign in on the back. Now, is that adequate training? It may very well be adequate training, but have you actually been able to set any kind of a standard as far as their ability to perform or to recall the protocol and really apply it to a patient? And one of the things that we do is that we at Parallax Online is to work with the sponsor to put together a training program that not only trains the protocol, but then also through our case path simulation, we create patient simulations. And so as a simulated patient, you can take a patient for a test flight, and as a result, you are able to go through a complete case with the patient, which you are now interpreting based on the protocol and using critical thinking and critical thinking process to actually determine whether that person is an effective participant for your trial. So one of the things that we're looking at is how can we do more effective training, make it more accountable so people actually can be certified, and you're looking at people having a protocol knowledge and ability to apply that protocol knowledge for a much smaller amount of money than you would be paying in an investigator meeting. Somewhere, I mean, it can be as much as 80% savings. And we do actually custom protocol training for our clients. So they'll come to us with a study that they are going to be conducting. We work with them on the protocol, put together a training program that is specific to that protocol, and then we also do the case path simulations that are based on that. We also do rater training to ensure better inter-rater reliability. And that rater training, we've done it for like interpretation of imaging and also for things like range of motion on stroke studies, that type of thing. So really how to apply the measurement instrument in a very rigorous method and making sure that people are interpreting it properly, and again, so you have better inter-rater reliability. We use instructional design and instructional design discipline to make it more interactive, make it more engaging, and also to look at what it is that the people really need to know. What is it they need to learn and take away from the training? And when they are learning that, we can evaluate not only their recall of the knowledge, but also their application of it through the case path simulations. So what we do is we break up our training into chunks, probably about 15-20 minute chunks, and each one of those then has activities related to that. So it's engaging, and it's also small chunks that are doable in a short period of time, so that if you have 20 minutes or half an hour during the day and you want to take some of the training, you can chip away at the training and actually make progress to the training without having to dedicate an hour and a half, 2 hours of your time to watch a video. We work with the sponsors, and then after that we coordinate with the CROs and the CRAs, because a lot of what we do feeds back to the CRAs as far as the performance of people on the sites, and whether, and that's part of the accountability that we offer. We have been in business for about 4 years. One of the things that we do pride ourselves on, and we have upwards of 90% completion rate on our training, which means that people are certified to a mastery level in training, which could be 80, 90%, 100% if you want to. That means that they have passed quizzes, and they've also gone through and demonstrated that they have not only the mastery of the content and the knowledge and the recall of the material, but they've actually been able to apply it to a real patient. And one of the things that's really important, we think, is that it's probably better to have them practice on a simulated patient, applying the protocol, rather than when they're actually practicing on the first patient being one that you had to pay a lot of money to recruit.